Dry powder inhalers. In this video, we will be going through how to use a dry powder inhaler correctly to ensure accurate delivery of a dose. DPIs are breath-activated devices. This means that a dose of medication will only be delivered when you inhale on the mouthpiece. As there are many dry powder inhalers available, different inhalers may be used in different ways. However, the steps follow a similar pattern. Step 1. Open the inhaler. Step 2. Load a dose. Step 3. Breathe out. Breathe away from the mouthpiece of the inhaler. Do not blow directly into the inhaler. Step 4. Inhale dose. Place the mouthpiece in your mouth and form a seal with your lips. Breathe in deeply. Remove the inhaler and hold your breath for up to 10 seconds. Breathe out slowly. Things to take note of. Do not breathe out into the inhaler. To use a dry powder inhaler properly, you must be able to breathe in deeply with enough strength. Always keep the cap on your inhaler when it is not in use. Store in a cool, dry place away from direct sunlight. We hope that you have learned some important tips on how to use a dry powder inhaler. You can watch the rest of our inhaler videos here. Visit Medical Channel Asia for more Asian health information and news at your fingertips.